ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello, welcome, and thanks for tuning in to ECDC On Air, the podcast of the European Centre for Disease Prevention and Control. I'm your host Lee, recording from our headquarters in Stockholm, Sweden. On today's episode, we're sitting down with Maria Keramarou, expert in vaccine preventable diseases here at ECDC, to discuss the rising number of cases of measles in Europe, how serious of a disease it is, and why vaccines offer the best protection from it. So today we're sitting down with Maria Keramarou, expert in vaccine preventable diseases here at ECDC. Maria, thanks for joining us.
Thank you, Lee, for the invitation to be here with you.
So we're going to be discussing measles today. For someone who might not know much about what measles is, could you tell us a little bit about what exactly it is and why it's so contagious?
Sure. So measles is a highly contagious acute viral disease that is caused by the measles virus. The virus is transmitted mainly through droplets, so when an infected person coughs or sneezes. The virus can remain viable in the air or on the surfaces even up to 2 hours. People with measles can spread the virus even before they know they have it, so that is the most tricky part. Usually the contagious period starts 5 days before the onset of measles rash and can last up to 4 days after. Also, measles is actually the most contagious disease we know so far. So studies have estimated that an average of 12 to 18 susceptible people can be infected from a single person that has measles. And just to put that in comparison, the same number for COVID-19 is about 4 to 5 people. So you can imagine measles is really contagious, and that is why it's so important to keep measles vaccination rates so high in order for the virus to stop spreading.
Okay, so what are some of the typical symptoms of measles that everyone from parents to teachers to healthcare workers, what should they be aware of? So what would be the early warning signs?
Measles typically starts with very non-specific symptoms like cough, sneeze, a runny nose, sore throat, red inflamed eyes, and the symptoms usually appear like 1 to 2 weeks after the person comes in contact with the virus. So this can be very easily mistaken, as you can imagine, with a regular cold symptoms. Only that in this case, they become more serious and far more quickly. A very critical early diagnostic indicator is the presence of coupling spots. These are tiny little white spots that appear in the inside of the mouth, and they usually show up 1 to 2 days before the onset of the rash. And this is a classic early warning sign of measles. Also, another important diagnostic indicator is the measles rash, a red blotchy skin rash that typically appears 3 to 5 days after the initial symptoms, starting usually on the face, around the hairline, and slowly spreading down to the rest of the body. The people who are most contagious are during the period before the onset of the rash, and which makes early diagnosis and vaccination so important in preventing the spread of the virus.
So what you're saying is you could potentially be sick for like 2 weeks, then you start to have this sort of cough, the red eyes, possibly fatigue as well, and then 5 days after that, that's when the rash would appear. So in theory, it could be even up to 3-4 weeks that you could be sick without realizing.
Yeah, usually, up to 2-3 weeks. That's true.
So what are the first steps when someone realizes that they might have measles? What are the first steps that they should take, and what can they do to prevent the spread?
If someone suspects that they have measles or possibly their child have measles, it's very important. The first thing they do is they stay at home, basically, and avoid any contact with other people, especially the most vulnerable ones like babies or pregnant women or people with weak immune system. So because measles we said that it's so highly contagious and can actually stay up in the air or on surfaces even up to 2 hours a person has left the room. So the first thing they should do is stay at home. Second thing is they should contact their healthcare providers by phone. And that is because we want to avoid any additional risk of exposing others to the sick person. For example, waiting rooms in hospitals or clinics. So the healthcare professional will then give them safe guidelines, safe instructions how to manage their symptoms at home on their own. And also if and when they need to reach the hospital if needed, and also if there is any need for vaccination around the close contact. So in order to prevent the further spread of the virus, which is the most important thing at that time, is firstly to isolate people who might have measles or who express the symptoms at home, and then assure the rest of the household members are vaccinated and safe. Early detection, responsible action, and communication with healthcare professionals are key to limiting the spread of measles in the community.
How long does measles usually last? Like from once you start having the symptoms like the rash and things like that, how long is it, like a week or a couple of weeks or?
Usually it is self-contained within a couple of weeks, especially if you're vaccinated. It can be even less this time.
Okay, and if you're not vaccinated?
Then it really depends on the underlying diseases and the risk of the group you're in. Usually a couple of weeks, unless of course you develop any of the complications, such as pneumonia, which is a very serious infection of the lungs, or encephalitis, which is swelling of the brain, that usually in about 25% of the people who will get encephalitis as a complication can also leave a sequela. This is long-term neurological issues that basically follows up for you for the rest of their lives. Also, some other complications that can appear could be serious eye problems or serious ear infection that can also lead to hearing loss.
Is it worse for children or is it worse for adults? If we're not speaking about, the underlying issues, just a normal course of the disease itself. We talk about it often that it's a childhood disease and you see often young children have it. But if an adult gets it, is it much worse or is it a lot easier for the adult to deal with because of the strength in their immune system?
Right, that's a very good question. So first of all, it's a misconception that measles is actually a childhood disease because from the data we see measles actually affect all age groups. If you belong in any of the risk groups, such as newborns, so infants less than 1 year of age that are not eligible to receive vaccination, or if you are unvaccinated children under 5, or people with weak immune systems, or adults over the age of 20, these are usually the groups that suffer the most complications and are also most susceptible, more possible to being hospitalized, end up in hospitals. In fact, 1 in 4 people who contract measles will be hospitalized and will belong to one of these risk groups that I mentioned earlier. And in 1 out of 1,000 individual who has contracted measles will die from the disease. And the most recent data in the EU, at least, we know that these are usually young children, so less the age of 5.
It's interesting you mentioning the data there. So recently, both ECDC and WHO Europe have warned that measles is back in Europe with a 10-fold of increase in cases in 2023 and 2024, just in the EU EEA alone. What are some of the factors that are contributing to this rise?
Indeedly, this is true. So measles is making a very strong comeback to Europe. During COVID times, we observed a huge reduction in the cases reported to ECDC. So we saw some really unusual low activity of measles happening around Europe. But on one hand, this makes sense because there were so many protective measures that was implemented during the period. So already in 2023, we start seeing a rising of the cases. And now in 2024, more than 35,000 cases reported from all European Union countries in ECDC. That is 10 times more than the year before. And it is actually the highest number we have ever seen in all these years we've been monitoring measles in the EU. The disease is affecting people from all age groups, not just children. And on top of that, in 2024, we had 23 deaths registered from measles, including 14 children under the age of 5. As you can imagine, these are really high numbers. And these are numbers that are caused, both cases and deaths that are preventable, are caused by a disease that we do have a safe, a very effective vaccine, and that all EU, EA countries have included it in their national immunization program. So this is tragic, basically.
Well, I mean, that's one thing I wanted to move on to now is, so immunization really is a cornerstone of public health. Can you explain a little bit more about how effective immunization is in preventing measles and how it protects people?
Yeah, so measles vaccine is one of the most powerful vaccines we have in our toolbox. It's very safe, very effective. In Europe, the measles vaccine is most commonly administered via the MMR, which is a triple vaccine protecting you against measles, mumps, and rubella. It demonstrates very high efficacy, offering approximately 93% protection with a single dose and over 95% with 2 doses of vaccine. It also offers a long-lasting protection, so meaning people who receive these 2 doses of MMR vaccine will actually be protected for life. Vaccination offers both immediate and long-term benefits. For individuals who receive the vaccine, of course, they are protected against the disease, against the complication, and a potential death due to the virus. On the long run, also protect others by reducing the spread of the infections. That way, vaccination is not only an act of self-protection, but also one for solidarity.
So we often hear about the term population immunity or herd immunity, particularly during the COVID pandemic. Could you explain what this means in simple terms and why it's crucial in preventing outbreaks of a highly contagious disease like measles?
Herd immunity is basically a term we are using in epidemiology to describe when enough people in a community are protected against the disease, either through vaccination or through natural immunity, so the disease can no longer spread easily. In the case of measles, this threshold is set to about 95% vaccination coverage in order to achieve the herd immunity. So, for example, we have a community that consists of 100 people. If 95 of them receive a vaccine against the measles, then the virus means they can no longer spread easily. As a result, protecting the remaining 5 people. These are often people who can't be vaccinated, either because they are too young, like babies, or because they are immunocompromised individuals. But if vaccination rates drop below this threshold of 95%, then the virus can spread very quickly and putting these vulnerable people at serious risk. This is exactly actually what we are seeing right now in some parts of Europe, with outbreaks being on and off because not enough people are getting vaccinated. That is why it's so important to keep high vaccination coverage to protect everyone, especially those who rely on others to keep them safe.
What are some of the main reasons for people not to vaccinate? And what are the potential health consequences of these gaps? Obviously, as you said, we're seeing more and more cases arise. Is that what we would see more and more if people continue to not vaccinate?
Unfortunately, there is no single answer to your question, Lee. The situation varies a lot between the countries in EU, and it can also vary between different regions within one country. So some of the main reasons why people are not vaccinated, although I have to tell you that all EU countries do have a national childhood vaccination schedule, and it's very strong in the majority of them. So they do maintain a high vaccination coverage, but there are still groups of people who are unvaccinated or under-vaccinated. And this is exactly what we call immunization gaps. So there are different reasons for this creation of immunization gaps. For example, access issues. Some communities may be very hard to reach with vaccination campaigns. Others may have trouble accessing healthcare themselves especially older children or older adults, ended up in missing their earlier doses. Also, lack of information or awareness. Some people simply don't know when or why they need a vaccine. Another point can be hesitation or low acceptance. Not everyone who skips a vaccine dose is against vaccination. Some people may simply do not understand the importance of being vaccinated, especially if they think measles is no longer a risk or if it is a disease from the past. What happens when the vaccination rates drop? The consequences of these immunization gaps are very serious. Measles, as we saw earlier, is extremely contagious, and we need a threshold of at least 95% vaccination coverage in order to keep the vulnerable groups safe. But if we don't get to this threshold, then we open up the door to different outbreaks, as we already are seeing in multiple EU countries. These outbreaks can be dangerous, especially to newborns or people with weak immune system, and they also put a lot of pressure in the healthcare system, as the majority of them will need to pay a visit to the hospital or even get hospitalized. So in order to close these gaps and protect everyone, there is a combination of actions that are required to be taken into consideration, such as performing catch-up vaccination campaigns, especially to those who have missed doses in the past, sharing clear, trustworthy health messages, and making sure everyone can easily access getting vaccinated. Everyone deserves the chance to be protected, and reaching the 95% target is the key to keep measles under control.
So there's a lot of information and misinformation about vaccines. What can you tell us about the safety and effectiveness of the MMR vaccine?
Indeed, today everyone can find a lot of information online or read different sources, but not everything you read is true and based on science. So when it comes to vaccine, there's a lot of misinformation that can cause further confusion or fear. And that is why it's important to focus on facts and trusted sources, especially when we talk about the measles vaccine. The truth is, measles vaccine is safe, well-tested, and highly effective. MMR vaccine has been used since the 60s and is one of the most well-studied vaccines we have. Like all vaccines, it's rigorously tested before approval and continuously monitored for safety. And to be clear, getting 2 doses of MMR vaccine is the only effective way to prevent falling ill with measles in the first place. Serious side effects from vaccine are very rare, less than 1 in a million, and usually include very light fever and maybe a sore arm for a couple of days. Measles vaccine is also very highly effective, offering 93% protection with 1 dose and almost 100% protection against the virus if you receive the full course, which is the 2 doses.
So my final question is, where can people find trusted sources about vaccines and measles?
Yeah, so it's really important, as I said earlier, to find the right information from the right sources. So I would advise, first and foremost, to talk to your healthcare providers, like your doctors, nurses, pharmacists. These are key people who can explain to you and help you understand what are the vaccines and what are the benefits of them, and will encourage discussions with you and help you make the best decision for your own family and for your own health and your family's health as well. We also have the European Vaccination Information Portal, which is an online platform created by ECDC, the European Commission, and the European Medicine Agency. It's basically a platform that provides clear, evidence-based information about vaccines and vaccinations in simple language. It is even translated in all EU/EEA languages and supports everybody's ability to make informed decisions about their health and the health of others. And lastly, I would recommend sources such as the website of the National Health Institute in your country or different brochures and fact sheets and other materials provided by official health authorities. These sources are created by experts and based on the latest scientific research. They're great tools for learning about vaccines and how to protect yourself and your family. In short, measles vaccines save lives. It's one of the most powerful tools we have to protect ourselves and the others. You need to stick to the facts, ask questions, and rely on trusted sources only.
Well, I think that's a great way to end this podcast. Thank you very much for your time today, Maria. We really appreciate it.
Thank you, Lee, for the invitation. I really enjoyed it.
We hope you found this episode informative. If you would like to know more about measles or vaccine schedules in Europe, please see the notes of this episode. If you would like to know more about ECDC in general, please visit ecdc.europa.eu or follow us on social media for the latest news. If you enjoyed this podcast, please give us a like or follow us on the platform of your choice. And don't forget to leave a comment or a review.